Hello everyone, this is Dr. Sushma Sarala, consultant homeopath at Fidicus Homeopathy. Next, coming into the body changes. So what happens in the breast tissue when we have or when there is development of this fibroadenoma? Let us know about the points of this body changes. First thing is the intracanalicular and pericanalicular growth patterns and also the biphagic growth patterns. First, let us know in detail what happens in the starting and then we will discuss about the growth pattern. As you can see in the picture, this is the breast tissue and these things are the lobes and inside them we have lobules. So what I have drawn here is the terminal duct, and from the terminal duct we have these lobules and all of these are in the lobe. Okay, so here there is tissue in between these lobules. This is called as interlobular tissue or interlobular stromal tissue, and there is tissue surrounding these lobules which is called intra. So this any problem within the intrastromal tissue or the intrastromal tissue surrounding the lobules, we have two diseases. One is fibroadenoma, the second one is called as phyllotumor. Any changes occurring in the intrastromal tissue can lead into two diseases, fibroadenoma and phyllotumor. But what happens in fibroadenoma is that this tissue, there is increase in this tissue due to estrogen hormone. Especially girls who are taking oral contraceptives, especially below the age of 20 or who have started taking oral contraceptives at their teenage age and they are continuing or taking a lot of oral contraceptives, these people can start seeing changes in the intrastromal tissue where there is increased in the breast tissue and also the connective tissue of the breast. This will cause for the formation of a lump. These are the changes that is happening in the body. And when you cut this lump and see when you cut this lump and see and put it on a plate, you will see that there are nodes in this and the nodes are bulging out. That means the lump is so tightly wound that whenever you cut open it, they will bulge out. So this is the gross morphology of that lump. And also if you see the lump directly like this, there will be slit-like spaces. That is, if this is the lump and you're seeing it like this, there will be slit-like spaces inside the lump. This is also the characteristic feature of fibroadenoma. Now, what is this intracanalicular and pericanalicular? Just remember that the intracanalicular, the pericanalicular, when you observe under the microscope, if there are slits, that is compressed, no space, no lumen. Lumen is called as space. If there is no space, that is no lumen, then that is called as intracanalicular. If there is space, if there is hole or if there is space, then that is called as pericanalicular type of fibroadenoma. It is one of the growth patterns. Next, what are the key features of it? Biphasic, well-defined borders, bland nuclei and low mitotic rate. This is something to deal with the histology. That is, when you observe a breast tissue, take a part of it and observe under the microscope, you will find that there are bland nuclei and low mitotic rate. What is low mitotic rate? Mitosis is division. So the mitotic rate is very low. That is why it is a slow growing tumor. Biphasic means two different types, stromal and epithelial cells are involved. Well-defined borders are the characteristic feature of this fibroadenoma. Remember, if the borders are fine or if the borders are margined and they are proper, then that is a characteristic feature of this fibroadenoma. If the borders are not proper or if you cannot diagnose or determine the proper borders of it, it can be breast cancer. Coming to the consultation part here at Fidicus Homeopathy. If you are suffering from fibroadenoma and you are looking for a proper treatment, here at Fidicus we are offering you with two types of online consultation and offline consultation. In online consultation, we are giving you with audio and video consultation options. If you have any sort of doubts or if you are having some investigations, lab investigations, you can share it with us, and if you need further more investigations, we will ask you for it. After doctor consultation, the medicines will be directly delivered to your home. If you are staying in India, then it can take 3 to 4 business days. If you are staying in USA, it can take 3 to 5 business days. Anywhere else, it can take 4 to 8 business days for our medicines to reach your doorstep. If you are staying near the nearest branch of Fidicus, you can come and consult us in person. If you want to get in touch with us, you can contact us through this number. You can WhatsApp us, message us or call us on this number. To know more about Fidicus Homeopathy, you can check out our website www.fidicus.com. If you are suffering from fibroadenoma, you are looking for a proper treatment, why should you choose Fidicus Homeopathy? The reason being that Fidicus Homeopathy is the highest chance of health. Here we follow three principles. First is already treating the fibroadenoma cases with high success rate. The treatment options here are good with transparency. That means there is no gray area between the patient and the doctor. And also the personal care that we give here. Any sort of doubts or queries or myths that you have regarding your disease will be cleared, and also we will advise you on a better lifestyle. If you're suffering from fibroadenoma and you're looking for a proper treatment, why should you opt for Fidicus Homeopathy? Fidicus Homeopathy stands for highest chance of success. Here we follow three principles. Of the already treated fibroadenoma cases, we are having high success rates, and also the transparency in treatment. There is no gray area between the patient and the doctor. We will be telling you about your prognosis and what your case is to you. And also the personal care here at Fidicus is top notch. Any queries, any myths or any problems associated with your disease will be cleared out to you. If you are looking for a proper cure, try opting for Fidicus Homeopathy. Thank you.